part two, so we get why, we don't have health care as a right? Racism, essentially. How is it that we never got just a decent health care system in the United States? Well, obviously, prior to the 1980s, it had to do with racism. But the big thing that happened in the 1980s was in 1983 when Ronald Reagan instructed the Justice Department and the Federal Trade Commission to stop enforcing the antitrust laws. This was the greed is good era. This was the less government is better era. This was the deregulation era. And so we went from two dynamics, basically two dynamics got blown up. The first was when Reagan came into office, most health insurance companies in the United States were nonprofits, and most states require, in fact, most states required that, and most states required that all their hospitals be nonprofits. I ran a little tea company, herbal tea company in Michigan, and from 1972, I think it was, until 1978, called the Woodley Herber Company. And we sold herbal teas. We had a little factory and a bunch of employees, and healthcare was cheap. We provided healthcare to all our employees. And all three hospitals in Lansing were nonprofits. So what changed was that this Reagan revolution, two things. Number one, by ending the anti-monopoly enforcement, we went from hundreds of health insurance companies across the United States to about a dozen. And number two, by ending the requirements, state by state and federally, by ending the requirements that health insurance companies be nonprofits and that hospitals be nonprofits. Nonprofits, of course, their first goal is to serve their customers. They don't make a profit, whereas a for-profit, their first goal is to show a profit for their owners and stockholders. So, these two things just kind of combined to make this dozen or so health insurance companies that came out of the Reagan deregulation so wealthy and so powerful that anytime a politician stood up and said, gee, maybe on the health insurance industry, they would just squash him like a bug. This is an industry that's making $1 billion a month in profits. This is an industry that could buy any politician in America who is willing to be bought, and probably has. This is an industry that can carpet bomb America with television advertising, with for months at a time, with a single day's leftover profits. And so when Joe Lieberman, for example, was the deciding vote on whether we would have a public option, which would give everybody in America the option of buying into Medicare, which the health insurance companies, of course, correctly saw as the camel's nose under the edge of the tent, right? The beginning of the end for them. They gave Joe Lieberman over $1 million through his career, and he said no to the public option. He's the guy who killed it. And he was a Democrat. Well, actually, he was an independent then, as I'm forgetting which politician it was who said it. But, Paul Begala actually said, it says, Joe Lieberman, I, Connecticut, like I is for independent. He said, I should stand for insurance. Of course, he was from Connecticut, which is where some of the biggest insurance companies in the country are based. So it shouldn't surprise us, except that under the laws in the 70s, in the early 70s, it would have been illegal. But the U.S. Supreme Court said, money is speech, and if the health insurance company industry wants to buy politicians, that is simply them exercising as corporate persons their right to free speech, their First Amendment right to free speech. And that's why we haven't seen an expansion of Medicaid in the states. It's why we haven't seen Medicare for all. It's why we haven't seen anything like it. In the last part of this hour, I'll get into how we could have Medicare for all in the United States, how other countries have done it. We'll be right back, though, with Medicare Advantage.